The Elder Care Protection Act just became law. Here's what they're not telling you. The hook that changes everything. Stop what you're doing right now because what I'm about to share could put thousands of dollars directly back into your hands, and the majority of American seniors won't even realize it happened. A sweeping piece of legislation has just cleared the United States Senate, and it's being quietly described as the single most significant senior-centered law passed in more than a generation. It goes by the name the Elder Care Protection Act. And if you're over the age of 60, if you're helping care for an elderly parent, if you're getting close to retirement, or if you're currently depending on Social Security and Medicare to get by, this law touches your finances, your healthcare, your home, and your entire future. But here's the part that should genuinely anger you. The major media networks are barely scratching the surface on this. They've handed you the headline and then moved right along to the next breaking story. Meanwhile, tens of millions of seniors throughout this country have absolutely no clue what's actually written inside this legislation, what they're now legally entitled to receive, or, and this is the critical part, which deadlines they risk missing if they don't take action soon. Certain benefits kick in automatically. Many others do not. Some demand that you submit an application. Some require you to update your records with the appropriate agencies. Some come with enrollment windows that, once closed, are closed permanently. If you miss them, they're gone. So today, we're laying everything out in full detail. Every major provision broken down in plain, everyday language. No confusing legal terminology, no political agenda. Just the straightforward, practical, dollar and cents reality of what has just changed for American retirees and the families who support them. Grab something to write with, take notes as we go, and make sure you pass this along to every senior in your life. Let's get into it. The background. Where this law came from and why it matters. For generations, seniors in this country have been quietly fighting a system that was never truly designed with their needs in mind. Prescription medication costs that made absolutely no sense. Nursing facilities operating with almost no real oversight or accountability. Social Security adjustments that consistently fell behind what things actually cost in the real world, year after year. And a relentless wave of financial exploitation targeting elderly Americans, schemes that have drained the life savings of millions of hardworking retirees who did everything right. These weren't minor frustrations or manageable inconveniences. These were full-scale crises unfolding silently inside millions of American homes across the country. And for far too long, those in positions of legislative power looked the other direction and did nothing meaningful about it. The Elder Care Protection Act changes that reality. This is one of the most thorough, wide-reaching pieces of senior-focused legislation in the entire modern history of American lawmaking. It reaches into nearly every corner of life that matters most once you pass the age of 60. Healthcare access, housing stability, personal finances, mental wellness, family caregiving, and individual safety. The reason we need to go through every detail carefully is simple. The news cycle moves at lightning speed, but the specific provisions, the real practical changes, are where the genuine money and meaningful protection exist for you and for everyone you care about. Chapter 1. Prescription Drug Pricing. Reform. Real dollars back in your pocket. Let's begin with the change that has already sent pharmaceutical corporations into a quiet panic. Prescription drug pricing reform. If you are currently enrolled in Medicare, this is news you have been waiting your entire retirement to hear. For years, decades actually, Medicare stood as the single largest purchaser of prescription medications in the entire United States. And yet it was legally forbidden from negotiating drug prices directly with pharmaceutical manufacturers. Read that sentence again carefully. The biggest single buyer of medications in all of America was explicitly prohibited by law from using its massive purchasing power to push prices downward. Private insurance companies could negotiate. The Department of Veterans Affairs could negotiate. But Medicare, the program that covers more than 65 million American men and women, could not. The outcome of that absurd restriction was entirely predictable. Seniors in this country were paying some of the most inflated prescription drug prices anywhere on the planet for the exact same medications that residents of Canada, Germany, and Japan were purchasing for a tiny fraction of what Americans paid. The Elder Care Protection Act expands and dramatically accelerates drug pricing reform. Under the new provisions included in this legislation, Medicare now holds the authority to negotiate prices across a much broader range of medications than previously allowed, and those newly negotiated prices take effect on a faster timeline than anything we've seen before. What does that mean for you personally? If you're currently spending $200, $300, or even $500 each month on medications for conditions like diabetes, heart disease, arthritis, high blood pressure, or elevated cholesterol, there is a genuine and realistic possibility that those costs are about to decline. Not at some vague point years from now, but on a rolling schedule that has already been set in motion. The legislation also establishes a hard annual cap on out-of-pocket prescription drug expenses for everyone enrolled in Medicare. That means there is now a legally enforced ceiling on the total amount you can ever be required to spend on medications within a single calendar year, no matter how many prescriptions you fill, and no matter how expensive those medications happen to be. For millions of seniors who have been forced to make the heartbreaking choice between picking up a prescription and buying food to eat, this is not a small administrative adjustment. This is genuinely life-altering. Chapter 2, Social Security Changes. More money in every single check. Now let's turn to Social Security because this section tends to generate strong emotions, man, for very good reason. Social Security has served as the financial foundation of American retirement since 1935. It was constructed as a solemn, enduring promise. You put in the work, you make your contributions, and when your working years come to a close, the system honors its commitment to you. But over time, that promise began to feel increasingly hollow and unstable. Cost of living adjustments, commonly known by the acronym COLA, are specifically intended to protect your monthly benefits from the damaging effects of inflation. Each year, the Social Security Administration reviews inflation data and modifies your payment accordingly. But here is the uncomfortable truth that seniors have been raising their voices about for years. The inflation measurement formula they rely on does not actually reflect the way seniors spend money. The standard formula tracks spending behavior among urban wage earners, categories like gasoline, consumer electronics, and job-related expenses. But seniors spend their money in fundamentally different ways. You spend a larger portion of your budget on healthcare services, prescription medications, in-home assistance, and utility bills, categories that consistently rise in cost faster than almost anything else in the broader economy. The Elder Care Protection Act addresses this disconnect directly and intentionally. It advances the adoption of an inflation measurement index designed specifically to reflect the actual spending patterns of older Americans. Translated into plain language, your annual Social Security adjustment will finally begin to reflect what your daily life genuinely costs. Over time, this correction alone can mean hundreds of additional dollars annually flowing into your budget. When you're living on a fixed income, a more accurate inflation adjustment that compounds year after year accumulates into something truly substantial. The legislation also reinforces Social Security's financial stability over the long haul. The trust fund had been on a trajectory toward depletion sometime in the mid-2030s, which would have automatically triggered painful cuts to everyone's benefits. Nobody, regardless of political affiliation, wanted to see that happen. The new law adjusts the payroll tax cap so that higher-earning individuals contribute a fairer share to the system, stabilizing Social Security not just for current retirees, but for your children and grandchildren as well. Chapter 3, Nursing Home. Reform, real accountability at last. Let's move on to nursing home reform because this portion of the legislation receives far less public attention than it deserves, and it is absolutely critical for millions of American families. The uncomfortable reality is that nursing home abuse and neglect has been a persistent, devastating, and widespread problem throughout the United States for many years. Federal investigations and government reports have repeatedly documented that a deeply troubling percentage of long-term care facilities have been cited for serious regulatory violations. Inadequate staffing levels, unsanitary conditions, medication errors, and, in the most disturbing cases, outright physical and emotional mistreatment of residents. Under the Elder Care Protection Act, nursing homes and long-term care facilities that receive Medicare or Medicaid funding, which encompasses nearly all of them, are now held to significantly stricter staffing standards than ever before. The new regulations mandate minimum caregiver-to-resident ratios that must be maintained. Translated into practical terms, this means your mother or your father will have a real, properly trained human being available and present when they need assistance. Not a single exhausted, overworked staff member struggling to manage an entire unit of residents alone. Financial penalties for safety violations are also being dramatically strengthened. In the past, fines were frequently so modest that many facilities simply absorbed them as a routine operating expense and continued their problematic practices without meaningful change. That era is over. Penalty amounts are increasing substantially, and facilities that repeatedly violate safety standards now face the very real possibility of losing their Medicare and Medicaid funding altogether, which represents an existential financial threat for the overwhelming majority of these operations. New transparency requirements have also been put in place. Nursing facilities are now required to make their inspection records, staffing figures, and complete violation histories publicly available and easily accessible. That means when you research a facility for yourself or for a parent or spouse, you will have access to the full, unfiltered picture, not simply the polished, cheerful marketing brochure they hand you during a scheduled tour. Chapter 4. Elder Financial Fraud Protection, Stopping a Silent Epidemic. Now let's turn to a subject that has been critically underreported for far too long: financial fraud targeting older Americans. This is a silent epidemic, stripping tens of billions of dollars from American seniors every single year. The predatory schemes take countless forms: fraudulent calls impersonating IRS agents, Medicare fraud operations, investment scams designed to look legitimate, romance fraud targeting widows and widowers who are grieving and vulnerable, contractors who collect a deposit and then disappear entirely, and tragically, heartbreakingly, even trusted family members or personal caregivers who exploit their access to an elderly person's accounts and finances. Federal law enforcement agencies have consistently identified elder financial exploitation as one of the fastest-growing categories of criminal activity in the country. Victims frequently feel too ashamed, embarrassed, or disoriented to come forward and report what happened to them, which allows perpetrators to continue operating. The Elder Care Protection Act establishes a dedicated, sustained funding stream for elder fraud prevention efforts and aggressive prosecution of offenders. This translates to more federal investigators who are specifically trained to pursue these particular crimes, greater resources devoted to helping victims recover what was stolen, and stronger coordination among federal agencies, state and local law enforcement, and financial institutions. Banks and credit unions are now either required or strongly directed to flag suspicious activity on accounts belonging to senior customers and to maintain clear, consistent protocols for reporting signs of potential financial exploitation. Sudden large withdrawals, multiple wire transfers sent to unfamiliar recipients, a new name unexpectedly added to an elderly account holder's records. These are warning signs, and financial institutions now carry both the legal tools and a defined responsibility to respond to them. Significant funding has also been allocated for public education campaigns directed at seniors themselves, because the single most effective defense against fraud is informed awareness. When you genuinely understand the tactics and psychological techniques that scammers deploy, you become extraordinarily difficult to deceive. Chapter 5. Housing and Aging in Place. Stay in the home. You love for most seniors, your home represents your most valuable financial asset and the emotional center of your entire life. The ability to age in place, to grow older surrounded by your own memories, your neighbors, and your community, is something almost every older American deeply wants. But the hard truth is that most homes were simply not built with the later decades of life in mind. Staircases become treacherous. Bathrooms lacking grab bars become dangerous accident waiting to happen. Narrow hallways and doorways become barriers to independence and mobility. And the modifications needed to address these hazards can carry price tags of thousands of dollars that seniors living on fixed incomes simply cannot absorb. The Elder Care Protection Act meaningfully expands funding for home modification assistance programs, making grants and low-interest loan options available to help eligible seniors make the changes necessary to remain safe in their own homes. Qualifying individuals can now access financial support to install entry ramps, widen doorways for mobility equipment, add walk-in shower configurations, upgrade lighting throughout the home, and make kitchen spaces more accessible and functional. These are not luxury upgrades or cosmetic improvements. These are the specific modifications that allow you to remain safe, independent, and out of an institutional care setting for as long as possible. The legislation also makes a substantial investment in the development of affordable senior housing. Communities designed from the ground up with accessibility, convenient healthcare access, and meaningful social connection as core priorities. And why does that final element matter so much? Because chronic loneliness among older adults has been scientifically demonstrated to cause health damage equivalent to smoking 15 cigarettes every single day. That is not a figure invented for dramatic effect. That is documented, peer-reviewed research. Chapter 6. Mental Health Access, Breaking Through the Silence. The Elder Care Protection Act contains significant provisions that expand access to mental health services for seniors enrolled in Medicare. And this deserves far more attention than it typically receives. Currently, accessing mental health care through Medicare is complicated, often expensive, and frustratingly limited in scope. A substantial number of licensed therapists and counselors choose not to accept Medicare patients at all, because the reimbursement rates the program offers are simply too low to make participation financially viable. On top of that, the cultural stigma surrounding mental health, which tends to run particularly strong among older generations, prevents enormous numbers of seniors from seeking help, even when their need is genuine and urgent. The new legislation improves reimbursement rates for mental health service providers, making participation in Medicare more financially attractive, and thereby expanding the pool of professionals available to seniors. It also dramatically expands telehealth access, meaning that seniors living in rural or remote areas, or those whose physical mobility makes travel difficult, can now access professional counseling services from the comfort and privacy of their own home. Grief, loss, chronic physical pain, fear of becoming dependent on others. These are genuine, heavy burdens that millions of older Americans carry with them every single day. Meaningful, accessible help is finally becoming a realistic option. Chapter 7. Caregiver Support, The Hidden Heroes. Finally receive recognition. We need to spend real time discussing caregiver support because this affects tens of millions of American families and almost never receives adequate public attention. There are an estimated 53 million unpaid family caregivers operating in the United States at this very moment. Sons and daughters, husbands and wives, brothers and sisters. People who have taken on enormous, life-consuming responsibility for the care of an aging loved one while simultaneously holding down employment, raising their own children, and managing their personal health challenges. The toll these individuals carry is staggering and largely invisible. Caregiver burnout is a documented, serious condition. Depression among family caregivers is extraordinarily common, and yet historically these unsung heroes have received almost nothing in the way of financial support, practical training, or even basic public acknowledgement. That changes under this legislation. The Elder Care Protection Act introduces meaningful new tax credits for family caregivers, allowing them to recover a portion of the money they spend providing for a loved one's needs. It allocates funding for caregiver training programs that equip people with skills and knowledge they currently have to acquire on their own. And it expands respite care options, giving caregivers the ability to take necessary breaks from their responsibilities without carrying crushing guilt. A properly rested, adequately supported caregiver delivers better, safer, more attentive care to the senior they're helping. Everyone in that equation benefits when caregivers are treated as the essential contributors they truly are. Chapter 8. Medicare Expansion. Dental, vision, and hearing coverage. There has been robust and often heated debate for many years about whether Medicare should be expanded to include dental, vision, and hearing services, Original Medicare, as it has existed for decades, provides no coverage whatsoever for routine dental care, eye examinations, or hearing devices. A remarkable gap when you consider the health consequences of leaving these needs unaddressed. Untreated gum disease carries documented connections to cardiovascular disease and cognitive decline. Uncorrected vision problems significantly increase the risk of dangerous falls, and hearing loss stands as one of the most consistently identified risk factors for the development of dementia. These are not cosmetic or optional services. These are fundamental, foundational healthcare needs for an aging population. The Elder Care Protection Act makes genuine, meaningful progress on all three fronts. New subsidies will assist Medicare beneficiaries in affording hearing aids, which routinely carry retail price tags of several $1,000s. Expanded pilot programs are increasing dental care access through federally qualified health centers that serve communities across the country. And funding directed toward vision services through community health programs is receiving a substantial increase. This is not the complete, comprehensive coverage expansion that patient advocates and senior organizations have pushed for over many years, but it represents a significant, concrete step in the right direction, and one that will have a real, measurable impact on the daily lives and long-term health outcomes of millions of older Americans. What you need to do right now. Do not skip this part. Here is the section you absolutely cannot afford to overlook or pass by. Not every benefit included in this legislation activates automatically. Some require you to complete an application. Some require you to update your information on file with Medicare or the Social Security Administration. Some come with enrollment windows that, once they close, do not reopen. Missing them means losing access permanently. Begin by contacting your local Social Security Administration office or visiting the official government website for the Social Security Administration directly. Schedule a meeting or consultation with your state's Health Insurance Assistance Program counselor, commonly known as SHIP. This is a completely free, entirely unbiased service that exists in every single state, staffed by trained counselors whose specific job is to walk people through exactly these kinds of changes and help them understand what they're entitled to. And please, listen to this warning carefully. Be exceptionally cautious of any individual or organization that reaches out to you claiming they can help you apply for new benefits under this legislation, while simultaneously asking for money up front or requesting sensitive personal information. Fraudsters are already constructing sophisticated pitches built around this law. Within days of any significant legislation being passed, criminal operations begin calling seniors specifically to steal Medicare identification numbers, Social Security numbers, and banking account information. This is a predictable, well-documented pattern. Legitimate government agencies and services are always free of charge. The Social Security Administration will never place an unsolicited telephone call demanding immediate action or threatening consequences. Medicare will never request your credit card information over the phone. If anything about a contact feels unusual, suspicious, or pressuring, end the call immediately, close the browser window, and dial the official published number directly to verify. Final thoughts. This is about more than a single piece of legislation. Take a moment to think about your own experience. Think about the specific instances when the system seemed to be operating against you rather than for you. Maybe it was standing at the pharmacy counter, quietly calculating which prescription you could afford to skip for another month. Maybe it was watching a parent suffer inside a facility that simply didn't have enough staff to provide basic, dignified care. Maybe it was that hollow, sickening feeling when you discovered that someone had stolen money from your account. Maybe it was sitting quietly by yourself on an ordinary afternoon, wondering whether anyone in Washington even knew you existed. This legislation is not a perfect solution. No single law ever solves everything, and anyone claiming otherwise is not being straight with you. But it is a genuine, substantial, earnest effort to make the lived reality of older Americans meaningfully and measurably better. And beyond the specific provisions and dollar amounts, it carries an important signal. A message that policymakers finally examined the real challenges facing seniors in this country and made a deliberate choice to say, "We see you. We hear what you've been dealing with. and we intend to do something real about it. Significant battles still lie ahead. Turning legislation into lived reality takes time and sustained effort. The large pharmaceutical corporations, the negligent care facility chains, the financial predators who profit from exploiting vulnerable people, none of them will accept these new rules without resistance. They will fund lobbying campaigns, they will pursue legal challenges, they will work persistently and patiently to erode every protection you just gained, one small exception at a time. Which is precisely why staying informed, staying engaged, and staying alert is not optional. It is essential, because the most durable, reliable protection any law can ever have is a population of people who understand exactly what is at stake and are absolutely unwilling to allow those protections to be quietly dismantled. Knowledge is power. Share this with every senior you care about.